Yeah, so the 2013 ACCHA guidelines for cholesterol, as you know, is very controversial. And one of the things they did was to move away from treating to a target. So the prior guidelines had said you should be targeting an LDL cholesterol of less than 100, and then the subsequent guidelines was less than 70, and the 2013 said get away with targets. So we wanted to see if getting to a certain LDL levels is important, or if achieving a certain percentage reduction in cholesterol is important. And that's one of the reasons we did this study. So in the TNT trial, it was atorvastatin 80 milligrams. It was compared with atorvastatin 10 milligrams. So in the other two studies, it was also atorvastatin, and in one of the arms was simvastatin. So we had over 13,000 patients from 3 of these clinical trials, and what we found was even in patients where the achieved LDL cholesterol levels were less than or equal to 70, in the subgroup of patients where the LDL reduction from baseline was actually less than 50%, these patients still had higher risk of events, which is very interesting because if you were saying you're just going to treat patients to less than or equal to 70, you wouldn't worry about percentage reduction. But we showed that percent reduction is actually important. And the same was true even in the group where the LDL achieved levels were greater than 70. And in other complicated analysis, we showed that the percent reduction of cholesterol from baseline is actually much more important than the cholesterol, the final achieved cholesterol levels. The take-home message is that it's not just giving statins to patients. We actually need to follow it up. We need to check the levels and see, is the medicine actually working, and are you getting this 50% or greater reduction? Because at least based on our findings, it suggests that achieving that greater than or equal to 50% reduction in your cholesterol from baseline is actually very important. And I can tell you this actually reinforces the 2013 guideline recommendation. In other words, it actually goes in favor and supports those guidelines.